Very good afternoon to all of you. Thank you, INREM and the organizers of this event for the opportunity to talk about some of the work we are doing at the International Center for Clean Water. Before I go in, I know I'm standing between you and lunch. Sundar, I have 15, 20 minutes. How much? 15 minutes? Okay. So I will spend a few minutes just introducing ICCW. Uh, And there is water and data implications. We are talking about water plus data. It's something like how do you add data to idli vada and make it Swiggy? You know, it adds a lot of value suddenly to something which is very mundane. So we're looking at water plus data and how it can add value. We've done some water security studies in districts. We just want to touch upon that because there were some discussions about water availability and how do we ensure long-term sustainability of water sources. We have done some work on real-time monitoring for the Jal Jeevan mission. There was a challenge, grand challenge, where one of the startups that we worked with had participated. There is some innovation in sensors that is going on for real-time monitoring, low-cost sensors. I'll talk about that. Hydroinformatics is the branch of science which is gaining prominence. It connects water data to health, to environment, to other socio-economic indicators, and trying to build models whereby we can predict what can be the future course of water and what can be the future course of the society. Digital twins is something I'll touch upon. We are in very, very early stages. This is more a learning phase for us, but since it was added as a topic by Sundar, I'm just going to touch upon that. Okay. So International Center for Clean Water is a not-for-profit society. It is located at the IIT Madras Research Park. Our vision is very simple. We are talking about clean water for all. We added the word sustainable to it. We start with any idea, we nurture that idea and translate it all the way to a scalable business for sustainable clean water. Our location, as I said, is in IIT Madras Research Park, which has many other centers of excellence. And there are several startups, which is the ideal ecosystem for research and innovation. This is the governing board. Just to say that it is under the governance of IIT Madras. And what we do are two aspects. One is we do a lot of work on research. This is what happens inside the laboratory. It's a 20,000 square feet of space. We do work on low-cost sensors and materials for water treatment, which are sustainable in terms of reducing the carbon and water footprint. We also do analysis of any kind of water quality parameter and validate technologies for third parties. It could be startups, it could be large organizations. And all this generates a lot of data, which has helped us to build models, simulate future progress of technologies as well as the society and hydroinformatics. Then we take some of this work into the field. We have implementation. We start with basic consultancy or studies, surveys, and bring in technology interventions. These are mostly emerging technologies which are integrated to existing technologies, whether it's an industry or a community. And we look at O&M support. It's not easy. I mean, I'm making it sound maybe rather simple. It's not easy to make technology stick in the societies where we are. We find it extremely challenging to leave it and ensure that it runs on its own. We try to build a social business model whereby there is some money that is generated. If it is a water treatment plant, probably there is a volunteer who gets paid to maintain it. There is some O&M expense that is factored for 3 years to build a corpus, and thereafter it becomes financially sustainable. We do conduct outreach programs, training programs. We're actually working with the Jal Jeevan Mission Assam to have a training program in the month of January. We've done one for the erstwhile Ministry of Drinking Water and Sanitation in 2019. Some of you may have attended that, and various other similar activities. Finally, we have a very robust startup ecosystem, which started with accelerator programs, and it is now matured into integrating backwards into incubation and early stage startups. So I'm not going into this in detail. Water plus data equal to value. There are a variety of contaminants today, both surface and groundwater, and they are significantly increasing. The new age contaminants are at parts per trillion levels, which makes it very difficult to analyze them. One doesn't know what health impact they are having. First of all, how do we trace presence of PFAS or microplastics or pesticide residue or pharmaceutical residue? This becomes very challenging. Then there is obviously the water nexus to energy, to health, to other parameters that I mentioned earlier. All we need today is fast and sensitive detection systems. How fast we can detect and how sensitive they are going down to the micro or nano level of their presence. And when we look at the sustainable development goals, almost all the goals are linked to water. So we believe that if we can touch water, there could be, multiplier benefits in terms of the other indicators. So typically when we looked at the various water monitoring techniques, conventional instrument analysis has always been there, sending a water sample to a lab. It is expensive, it is time consuming, and there are a lot of challenges in terms of the sample collection itself. Sensor placement approach is there. Today we have managed to put stationary sensors which are relaying real-time information to the cloud. And this is giving us a kind of a capture which we are able to relate to some of the changes that are happening in the neighborhood. Model-based is somewhere where we're looking at predicting, looking at other parameters and seeing if multiple parameters are present, can it predict a third or fourth parameter? And this is more like a AI ML kind of interface where we can even look at bacteria and see if certain combination of chemicals are present, then bacteria may not be present. It's an evolving space. Microfluidic devices are devices where we can concentrate. When I say parts per trillion level, these are able to concentrate this using, if it is a metal, it's easy to concentrate it with, let's say, a kind of electrolytic process, and we are able to detect presence of trace elements very rapidly. Spectroscopy is another one. Every water drop which has contaminants in it has its own signature, has its own, let's say, fingerprint. If you're able to relate it to a spectral image, it's possible to then relate it to the actual parameter, provided we have a large volume of data, and that has a very direct correlation. So sustainable water development, we are looking at how much water is available, how is it being used. We talked about equitable distribution. This is very important in a public distribution system. There is a non-revenue water, which is water that is pumped but doesn't reach the consumer. I think the Assam team has done a fantastic work, but I was about to ask the question when time ran out, saying, how can we use this platform to detect, can we make water affordable? I know most of the utilities are not making money because water is considered free, and therefore there is a reluctance in terms of, charging. At the same time, people are spending an enormous amount of money to just get clean water today. So there's a huge gap between perception and reality. I'm sure the database, a platform like what you have created, can help us to understand equitable distribution, can help us to understand quality of water that is being delivered, and end of the day get what is called a service level benchmark. A consumer gets something today, and there is a grievance mechanism. It's possible for them to keep feedback, and you can use that to see overall is their satisfaction level improving in the community. And that can really pave the way for charging more money and mitigating some of the challenges which are related to water in the other parts of the ecosystem, which may be health, energy, and so on. So quality at source, quality at en route, and quality at the tail node. And if they're recycling water, are people recycling water? And what is the quality of water after recycling? What is getting into the water bodies or ground level? Is it sustainable enough for us to withdraw and reconsume that again? So all this is required for sustainable water management. We did some work in Ramanathapuram, which is a drought-prone area. I mean, it's in the southern part of India. For decades, it has been starving of water. The collector there, he has 2 schemes that were developed by the Tamil Nadu Water and Drainage Board, or TWAD board. And the challenge was the water was coming from hundreds of kilometers away, somewhere near the Kaveri source. And by the time the water reaches, 50% of it is lost, and the remaining 50% is not equitably distributed because of various factors. There are political issues, there are geographical issues, and so on. And so we did a detailed study of what are the alternatives that are there in that district. Suppose water doesn't reach. Do we say that's it and let people fight for themselves, or is there something we can do? So what we did was we did a detailed mapping, a GIS mapping of every habitation that was there. There were 2,306 habitations across 11 blocks. And we found that many of them, these are villages, and all those reds are those villages where none of the habitations were getting even a drop of water. The blue were some of the habitations were getting and some were not getting. And those who were getting were minutes or hours on not just alternate days, it may be weekly or something like that. But they were getting some water and it was given a tick. Those which were green were the same situation, but every habitation was getting. So this is just one block. We did for all the blocks there. And we also mapped the population of the habitations. So once we know the population, we have the Jal Jeevan Mission's 55 LPCD for, let's say, a village. So we assume 10 LPCDs for drinking and say 45 is for washing and other purposes. So we know the demand. So you click on a habitation, you know what's the demand straight away. And then we know what the central supply scheme is delivering. This is based on a survey which was done. It was done through the village panchayat. They got the data. We didn't do ourselves. We said it's your data and this is the reality. Whether whoever has any difference of opinion, this is it. No, this is the status, because there's always multiple opinions. The TWAT board will say, no, we are supplying, but there's no metering, there's nobody knows. But they're collecting money. So there is always this dispute. I think all of you are aware of that. So we got this data, which is supposedly, from the horse's mouth. And what we did, or what we are attempting to do, the report is ready. We've said, why don't we give an app? Going back to Swiggy's Zomato. So what will this app do? It has a simple interface where you click on a block, a village, or a habitation and say how much water has been delivered today. It's obviously possible from an OH tank, which has some kind of a measurement system. And if you know the water that is available, you know the population, you know the shortfall immediately, instantaneously. And what we have mapped, if you can see all these dots are the local water sources. Some of them are good for drinking, some of them are not good for drinking, but could be used for washing and other purposes. So immediately, because it is mapped, at the back end, it knows for this habitation, what are the nearest sources. It triggers a message saying, move this water from there to the dispensing point, which is the standpoint in the village. And if this can be orchestrated, it is possible to actually deliver water at a particular time in a habitation. This is our proposal, to say that with data, you know how much water is there, what is the shortfall, where is the gap available. Today, people are doing it at their own whims and fancies. We want to bring in a system where the village panchayat or the block development officer says this amount of water, so-and-so will deliver it. So this is a mechanism we're trying to work out, which I think it could be a tanker or you switch on a pump and send the water there, right? So this is something which is in work in progress. The other thing we have done is, Pradeep Singh ji is very much aware, there was a company called INET Aqua, one of the startup companies that we had allowed to participate in this challenge. They have implemented real-time monitoring systems in about 13 villages in Haryana, Ambala district. And this was at the tail node. So there is a source node, where the water treatment plant is there. And you could measure the pH, the TDS, and chlorine. At least these three are critical. If there are special requirements to measure nitrate or fluoride or something, that could be added. Now at the distribution node, the pressure can tend to drop. There are leakages. So you find out if there is a difference in pressure unusually, and you know whether there is a leakage. And then there is a tail node. Of course, tail nodes are hundreds of them. Every house is a tail node actually. So how do we ensure that sufficient water reaches and is the quality good? So in this particular case, we looked at the most distant house in that village and said, if that house gets water and the quality is good, it is presumed that every house gets it. But this is more of a approximation, but something is better than nothing. This was a system that's been put in place. And these are the villages, and this is the kind of setup that is there, the monitoring unit. This is a stationary unit. So what we looked at is this unit inherently has a certain advantage in that it gives continuous information, but we are not able to find out the geographical spread of the data. So we looked at developing a field test kit, which is digital. Today, field test kits are dependent on color charts and high level of skill and reagent mixing and some chemicals. A BSc chemistry student must handle it, and still they could make mistakes. In our own experience, we found that no two reports tally because there is an approximation of reading color and coming to a judgment. So this small device here is a pocket device which has a kind of a photocell. And if you put a cuvette of water sample and put a couple of drops of reagent, this requires reagent. It measures the absorbance of light. There's a light source and there's a cell. And whatever the frequency is absorbed, it reflects that as the contaminant present. And it can be done for different contaminants. About 13 contaminants can be measured. And since it is connected by a Bluetooth to a mobile phone, it can measure the geography, the latitude, longitude, and upload the data onto the cloud instantaneously. So there is no error in capturing the data, minimizes the error, human error, both in the capture and the transcription of the data, and there is no time lost. And you can rapidly map the water quality of a community or a space. The other device which is shown here is a device which does not require any reagent at all. So it's like a briefcase. You connect it to a water flow. It could be a bore well. It could be a stationary source. You can pour water into that, or there is a pump which can pump water through this. There are about 13 electrodes in that, which can measure 10 parameters and flow and few other things. So 13 parameters in all. Again, within few minutes, it can measure the data and transfer the information to a cloud. So it actually depends on how fast we can take this device place to place so that we could rapidly map the water quality of a location. And a combination of this and the stationary unit. If you go back to the previous, so here there are stationary units, but there are distributions of habitations. So what we have suggested is if you can use either of these devices, of course, they cost a lot today. So we could look at a service model where cost per sample could be as low as 1,000 rupees or even less for 13 parameters, and you get it immediately. And you're able to build an algorithm which says, every day I measure a different part of the location. And over a period of time, I get a fairly good distribution of how the water is actually flowing and what I can predict actually what can happen tomorrow. So these are two things that are possible. So a digital field test kit reader, which gives information on an app. If some people said, can you give it on the display on the site itself, because not everybody has the access to an app. We said, why not? We can give it as a digital device. And the small one, which requires little bit of a reagent use and some skills. It's not as complex as a current digital field test kit reader. So that is what I just wanted to quickly touch upon. There are some other developments which are happening. Online fluoride sensor. Fluoride remediation today happens, but there are no online systems which can detect at the end of the treatment plant in every 15 minutes what is happening to the fluoride level. If the fluoride level goes higher, can it return the water back for treatment rather than sending it down the line? And there is a range between 0.5 and 1.5 parts per million. It will say, okay, beyond 1.5, it will give a signal. And we've got a fairly linear graph of this. So this is a prototype which has been developed. We're looking at implementing it in one of the kiosks which are there, which is in a fluoride infested area. The multi-parameter microfluidic device that I talked about, this is very much still in the laboratory stage. It is funded through an Indo-Korean kind of funding, where we are looking at all these places where you put a drop of water and it will move in this direction. This is thinner than a paper, this device, and it has a micro groove in it. So very, very minimum water quantity will flow there. And because you put electrodes below that, it will concentrate a certain ions. And if you want arsenic or cadmium or uranium or anything, you can concentrate it, and based on the current that it delivers, you know what is the ion and how much of it is there. So this is not yet commercializable, but it is where things are going today. And you can do multiple parameters with a single device. This I've already covered, the laboratory on call or a mobile unit, which can measure about 10 to 13 parameters instantly. And this is another device which we're looking at. It is still work in progress because it requires funding. What we are saying is, for a person in a village who wants to drink a glass of water, if he suddenly has a doubt whether I can drink it or not, now what will he do? He can't send it to a lab. He's thirsty. So can we give him a device which is like a small pen, and he puts it in that, and it gives a green light, means you drink it, red light, you don't drink it, okay? What does it mean? If you have a centrally treated water source, a utility, so they would have treated the water for basic contaminants. So anything that can change en route from the source to the place where it is consumed, can be a pH can change. If there is some leakage or some contamination, the TDS can change, and there may be microbial, So this is what it will measure. It will measure pH, it will measure TDS, and it will see if there is any residual chlorine present. If chlorine is absent, it will give a red light. Most of the time, it may be just chlorine, which is a problem. pH and TDS cannot really kill a person or make him fall sick. So we thought if we can give this device with a chlorine tablet and say if it is red, you put the chlorine tablet and drink that water. This may be a game changer for people in villages where drinking water is a crisis. And it'll also protect the administration from saying, look, we are taking care, just in case the last mile something happened, there is a device which can help. And if we can price it at 500 rupees for a family, it may not be a big, today it is not, it is still like a torch today. And it costs about 10,000 rupees. We're trying to make it, more affordable. Hydroinformatics, I'm coming to this. These are dashboards which are trying to link water quality with other parameters of interest to us, like health. So spatio-temporal water quality mapping is easily possible, as I mentioned to you. We've done with a set of college students in Chennai. And wastewater-based epidemiology. During the SARS-CoV virus, this became a hot topic because in fact, what it says is to monitor the health of the city. Now we're talking about cities, but we could also look at, wherever there's a cluster of population. You look at this, the STP, water going into the STP, it tells you a lot about the character of that place in terms of the kind of, products that they use, which may have carcinogens present in it. It could be personal care, face creams. It could be new viruses entering the community. It could be illicit drugs, narcotics, which are being consumed, or even normal drugs, and percentage of diabetic. These are non-invasive ways of understanding what is happening in a community and any changes before the hospitals come to know. It is possible to detect some spikes. And all this is possible today with mass spectroscopy, where all we do is collect large volume of samples, build a kind of a library, build certain stable, graphs, and see if there are any spikes which can show some kind of chemical or biological markers. Okay, and this is possible to extend it from a small place to the entire country. Digital twins, as I said, this is very early stages for us. But what we are attempting to do is, there is a village in Tamil Nadu, where it was found that a medical doctor did a PhD in IIT, and then he found that there was a sudden increase of diabetes, cardiovascular diseases, and cancer in the people of that village. And one of the things we found was there was arsenic present on the rice that was grown there. So arsenic in southern India was unheard of till that time. And where did this come from was the next question. So we built a hypothesis. We said it could be coming from two sources. One is from the farming practices, agricultural practices. The other is it could be because Bhavani water is fed through canals to this village during the season. So it's passing through certain industrial towns. It may be coming from there. So we had done micro data analysis of various water sources. We looked at the health, public health, data, and to see where the people are suffering and what kind of agricultural practices are followed. And we traced it to high usage of fertilizers and pesticides. When you use nitrates and phosphates, in the periodic table, arsenic is just below phosphorus. So in nature also, they are found together. So if there is phosphate, then traces of arsenic is present. And if excess of fertilizer is used, it can result in soil and water contamination, which is what we are finding. And then somehow it sticks onto the food products that are grown there. From there, it gets distributed. And whoever buys that product, wherever it comes to Chennai or Bangalore, and we found it only on the surface. Fortunately, it was not inside the food itself. So with washing, it will go away, but chances are, it may stick. So this is one such thing. There could be many other such possibilities of linking. This is not really a digital twin because this is static data. What we are trying to evolve is, we have put one real-time sensor, and then we have a field test kit to monitor what is happening in the neighborhood. We want to make it as real-time as possible so that if any change happens in the village, we pick it up on the digital twin, and we can simulate solutions. What if we were to make some changes in the practices? How will it reflect in the next, few months, few years? We cannot wait for so many years to find out the effect. But on a digital twin, maybe you can accelerate it and you can see the impact. And that may encourage more government to make some policy decisions or corporates to fund some kind of pilot projects. So that is what we are attempting to do here. So that's what I wanted to share. Thank you.